it's heartening to have local experts here educating the community while in Washington the Congress adjourned for the summer until after Labor Day without providing the necessary Zika funding dollars. Now what has happened is the HHS Secretary Burwell, has had to move money from cancer research, heart disease research, Alzheimer's, into Zika. So you're robbing a lot of other very important National Institutes of Health, CDC initiatives that were very bipartisan in order to kind of plug the hole in this sinking ship. That shouldn't happen. It's been very unfortunate, but at least here at the University of South Florida and across the state of Florida, we have experts in mosquito control, experts in research that are doing as much as they can.
Every day in Miami, it seems like there's a new non-travel related case, and some of them are outside that 1 square mile. It seems like we're going to miss the window to stop this thing spreading.
Yeah, when you have a public health crisis, it's very important that you do everything you can up front to prevent it. That means you develop the diagnostic test, you develop the vaccines, that you educate the community. And with the inaction in Congress, they've just made it more expensive, they've made it more time-consuming, and they've put a lot of lives at risk. We now have over a dozen cases of babies born in America with birth defects and microcephaly. That's a very serious condition. Those babies oftentimes can't see, they can't hear, they can't talk. So why do we continue to allow that to happen? Congress needs to return right away to provide the emergency funding to combat this public health crisis.
Is the Florida delegation on both sides of the aisle in unison on this?
They had everyone on a bipartisan basis has called for emergency funding, but what happened is right when the Congress adjourned, they adjourned on July 15th. A week before that, in the House, they rammed through a bill at about 3 a.m. that said, here's some of the Zika funding dollars, but we're going to also attach conditions that defund Planned Parenthood, that cut the Affordable Care Act, that it included provisions that would allow toxic chemicals in the water. So that wasn't a serious response, especially when you try to pass it. You ram through a bill at 2:40 a.m., send it to the Senate, say, okay, take it or leave it. That's not acceptable.
Knowing what's happening with Congress, which isn't much right this instant, are the local communities, mosquito control especially, are they doing enough in this area to prevent the local transmissions, which are happening now in the Miami area? Are you confident that people in Tampa Bay are safe?
We have some of the best mosquito control agencies in the country here in the Tampa Bay area, and they're doing everything they can. What is being delayed, vaccine development, because how we're going to prevent birth defects in the future is to be able to vaccinate pregnant women so that their fetuses and ultimately their babies do not contract those birth defects. So that's being delayed. The diagnostic test, you want to be able to have a test immediately to tell you do you have Zika or not. There are some diagnostic tests, but they take way too long. That's being delayed. Plus, if you rob other public health initiatives like cancer screenings, Alzheimer's, you're putting another population at risk. They've also raided the Ebola fund, while you still have cases of Ebola emerging in West Africa. So it's a wholly inadequate response from the United States Congress.
B from USF Health. As you see, USF is making Zika a priority. Discuss research and how you could potentially help our area. What are you doing to work across the aisle to help support USF as well as help tackle this issue?
Well, I'm pleased to be here today with my colleague, Congressman David Jolly from Pinellas County, and he's been outspoken on support for the University of South Florida, and I appreciate that. We've got to get the tools to our researchers here at USF and our other universities across the country, because that's where you do develop the prevention tools, the diagnostic tests, the vaccines. It's not really in the NIH labs. It's the money that NIH puts out to research universities across the country. And I'm confident, because USF is such a leader in health innovation, they could have some of the answers.
And how are you doing that?
Well, my job is to advocate for those research dollars. USF is the health innovation university in the state of Florida, attracting more research dollars than just about any other institute because of their integrated focus on health, public health, nursing, physical therapy. Across the street from the busiest VA hospital in the country, they're the only one with this mosquito lab that I was able to tour just now. If we could get the dollars to the scientists and researchers here, we would do a better job at combating Zika, preventing those birth defects, and probably many other diseases.
What are you hoping to accomplish at this conference today?
I'm here to remind folks that the Congress has been derelict in providing the necessary research dollars to develop vaccines and diagnostics, but also to learn what can I take back to the leaders at this Centers for Disease Control and Prevention, the National Institutes of Health. What do they need to know about what's happening here at the University of South Florida?
The things that Senator Rubio suggested in addition to the funding is an emergency, like rainy day fund for these kind of diseases. What is your response to that thought?
Boy, you know, we did provide that in the Affordable Care Act, the largest investment in public health and prevention in the country. The problem, or in the history of the country, the problem has been that it's become a partisan issue, and the Republicans in Congress have continued to raid and cut those dollars. So we are less prepared today to take on a public health crisis like Zika.
Is there any